And speaking about the weakness, it makes me think of, I know that right now as a society, we all about focused on gender-based violence and all of that, and helping women, which is very commendable. But I think in doing that, we have somehow neglected the men, and we have put so much pressure on men to be strong and to act strong and to provide, and it's not easy, you know. In COVID times, both men and women are losing jobs. Both of them are going through the pressure. Both of them are losing loved ones, right? But men are expected to just, hey man, be strong, continue providing, continue doing things. And I feel that kind of inhibits them from acknowledging when they are feeling weak, when they are feeling that I need help, you know, and we need to move away from that. I looked at the statistics when I was doing research on this, and it looks like South Africa's in the top 5 of suicide rates, and in that, the men are the ones who are committing suicide the most.
So it's important that we teach our men that it's okay to verbalize their emotions, because they go through the same things that we do as women. They suffer loss. They hurt as much as we hurt. But this thing of them constantly having to be strong, it's like now it's a sword that just sits there and it festers because they have no outlet. They internalize all this negative emotions, and they feel like there's no way out. When he loses a job and then he's like, oh, my whole world is over, now I can't provide, I'm a failure, I am weak, I'm useless, and then they turn to suicide because they feel like there's no other way out for them. They can't recover from this, they can't save face. But if they were given the opportunity to actually vocalize and say, I'm feeling like a loser, this is how I'm feeling because I cannot provide for my family, I cannot take care of my kids, help me, I think we might see a decline in how men deal with their own traumas, because they go through the same traumas that we as women do, but they're often neglected just because of their societal expectation that they need to be okay. And as a result, you find more women seeking assistance, help than men do. And we need to encourage them and normalize men seeking help for psychological issues.
So all of us are loved, all of us can go through this, and all of us deserve to be helped, you know. So wherever you are, male, female, rich, poor, black, white, be sure to check yourself, see where you need help, and if you do, be sure to get help. We want everyone alive, we want everyone healthy, and again, don't compare yourself to anyone. I know we touched a bit on the solutions, but I just want to understand, are the solutions for children the same as the solutions for adults? Because I know you spoke about children in school who are not mentally healthy, and that affects how they learn and stuff. But in terms of solutions, do children go through the same method of getting help? How can we as a family help a child? Is that the same way we have to help an adult? Can we just speak a bit about those solutions?
With children, how you help them, sometimes it needs to be age specific. You can't help a 3-year-old the same way you help a 12-year-old, because their development is at different stages. Their vocal abilities are different, their understanding is different, the way they express themselves is different. So for young children who are still learning how to express themselves, maybe their vocab is not all that developed yet, there's things like play therapy, art therapy, where we find different ways of getting them to verbalize, to communicate to us what is happening with them, what is wrong with them, what are they feeling, where does it hurt, what happened, tell us what happened. They can't say it, but they can show us what happened, they can show us where it hurts. So with kids, you need to be a bit more creative. You need to speak their language. Whereas with adults, they have the vocab, they have the words to explain what happened and what's wrong, how they feel, why they might feel a certain way. So, and it's important then when seeking help for children, you find someone who is comfortable with working with children, who has the experience and the knowledge on how to deal with kids who are going through this specific issue. So, like I said, there's no one size fits all. So do your research. Ask that person, do you deal with kids? This is the presenting issue. This is what I need at the end of the therapy session. Are you able to provide them? Can you assist? Is this something that you deal with? So you can't just say every therapist deals with a child. They don't. So you need to find somebody who is comfortable and is experienced in working with kids.
Okay, so if you at home might have a child who you can tell is not mentally healthy entirely, take the doctor's advice on seeking help for that child. And at home, if I have such a child, what can I do for them before going and throwing them to a psychologist or a therapist?
Talk to them. As adults, we need to learn to talk to our kids. It's time we open up, sit them down, talk to them, let them know that if ever they have a problem, they should feel comfortable enough to come to you and say, Mom, Dad, Auntie, Sis, Brother, this is what's happening. I'm not okay. I don't feel okay. I don't like school. This is what's happening at school. This is what kids are doing to me. Or when I'm at school, I'm sitting there. I can hear the teacher talking, but I'm not understanding. Then the child might need remedial assistance. They might need to see an educational psychologist. They need some kind of intervention. So create that environment whereby they can come to you, and also be observant. Because with kids, it's actually quite easy to see. It's easier to see when your child is not okay. They're not that good, as good as an adult can be at hiding it. You will see the child last week was happy, jolly, laughing. Now all of a sudden they're not eating, they're not talking to anyone, they don't want to interact with their friends, they just lock themselves up in their room the whole time. That might be a sign that something is happening. But before you jump to that conclusion, feel free, be comfortable enough to go to your child and say, I've noticed this. What's happening? Is there anything I need to worry about? Do you need to tell me something? And then you tell them, that if something is wrong, you can talk to me. I will not judge you. I will not be angry at you. I just want you to come to me so I can help you. Create that environment for your kids.
I think that speaks to the responsibility that we have as parents and aunts and sisters to our children, to help them have that environment wherein they are free to speak, they are able to express themselves and to let us know if anything is not okay, and they see how much we love them in identifying when the changes happen in their lives. And I think it's a privilege in as much as it is a responsibility, and we ought to take it serious as parents and caregivers. You spoke about psychologists and therapists and counselors. Can we just get a better understanding of the different professions that are there for mental health?
So you have your psychiatrist. A psychiatrist is basically, it's a medical doctor, your GP, but who went on to specialize in psychiatry. So they can prescribe medication to deal with mental health issues, for your more severe psychiatric illnesses, your depression, your psychotic illnesses, your schizophrenia, those kinds of. So there they deal with giving you pharmacological treatment. They medicate you in order to balance whatever's happening in your mind. It's about that. But they do also offer brief or minimal psychotherapy. They also do offer talk therapy, where they sit with you and they talk, because they have to, because they can't just medicate you willy-nilly. They need to know what is happening, what symptoms are you having, and they can also monitor, is this treatment working or not? Do we need to increase the dose, decrease the dose, maybe change the treatment? And then you have psychologists. So psychologists, we study psychology. We do an undergrad in psychology, and then in order to become a fully registered psychologist, then you do your master's in psychology, and then you either specialize in clinical or counseling psychology.
Okay.
Yes, and then you have your industrial psychologists who work in more corporate settings, more office, the ones you find at your workplace.
Okay.
Those psychologists who work with employers, with your employees. And then you have your educational psychologists who specialize more in the education sector. You know, they deal more with your school-going kids. And yeah, that's who you find in psychology. And then, of course, we have our social workers. They're more community-based.
Okay.
They study 3 to 4 years, and then they deal more with the system, the overall system. They don't just look at the individual. They'll look at the family setup. How can they're the ones who usually they'll do the home visits. They'll go see what is actually happening in the home. How can we assist in the home so that the whole system is working better, even though sometimes there can be a bit of an overlap between psychologists and social workers. In some areas, we work almost the same. We do some of the same things, but there is that difference between what a psychologist and a social worker does.
Okay.
Yes, because their scope, it's with the scope. We are only, what are you allowed to do? So you cannot step outside the bounds of what ethically and according to your own board, what are you allowed to do? Yes. Okay. And then we get our lay counselors. Okay. The ones they mostly focus on doing short-term therapy. And then all of these people, then they need to know when to refer to the next line, to the person, to somebody who deals, we can take this above. Yeah, we can take this further and implement certain things in order to ensure that the overall well-being of the patient is taken care of.
Okay. I hope that helps us all understand better. We just hear the words, but sometimes you don't understand who's who, what is the difference, and even in searching for help, you don't know who to go to. Yeah. So I hope that has helped. So Dr. KG, I think we've touched on a lot. Is there anything else that you wish viewers, the community, anyone and everyone will know about mental health?
Yeah, so it's important not to stigmatize people. It's important that as a society we get to a point whereby we make it okay for people to come out and say, oh, listen, I have a mental health issue. Even at work, they should feel free to disclose to their employers to say, I'm suffering from this, but I am on treatment and I will be okay. Just now and again, I might need time of work to go and see my therapist. I need an hour here or there just to ensure that I continue functioning well. If it's people who they can't access it after hours, they need to go during work hours. So as employers, they need to be sensitive to that, to say, okay, let my employers go and see someone, especially if they don't have EAP services at the workplace.
What is EAP?
Employee assistance programs. It's mostly, you find it's usually social workers who provide short-term therapy, and then they can refer further if they see that specialized help is required.
Okay. Yeah. All right. Just to conclude, I know that we spoke about cost of therapy. Do you have a mini background or breakdown of what can a person expect to pay if they don't go for free therapy?
When it comes to therapy, there's if you're on medical aid, most medical aids cover therapy, and it depends on the medical aid you're on and the plan that you're on how many sessions they cover and how much your therapist can actually charge per session. But most medical aids, they can give you a minimum of 4 to 6 sessions, but more can also be given based on the condition or the diagnosis that is given to you by your therapist.
Okay.
And if it's cash rate, anywhere from $850 to about, I think there's some who charge as high up as 1.5. But then, like I said, that also it
Location.
depends on location, and for some it's also how long they've been doing it. You know, it's the experience that goes with what they're doing, and then in specialized. Where do they specialize as well? What is their focus? So it depends. Are you going to need a report for this? Do you need an assessment? Is there more there? So it depends on the service that you're also asking. If there's an add-on to just talk therapy, then the price will go up depending on that. So with cash rates, it's therapist specific.
Okay.
But when it comes to medical aid, the rates are set per medical aid.
Okay.
Yeah. And then you can find, like we previously said, there are places where you can get free therapy. There's organizations, NGOs out there that can assist you for free.
Can we speak to those?
Yeah, and so you have your FAMSA, you have your Lifeline, SADC, South African Depression and Anxiety Group, the suicide helpline. You can call in, talk to someone if you're feeling a bit low, and then also they can also refer you to other free services that you might need.
Okay, so guys, you don't have to. If you can obviously pay that $8.50 to $1.5. If you can't, you can go for the free ones. But definitely, we're gonna list everything, and you can pick who to call and where to go. And help is available, so please be sure to get help. Any last words, Doc?
No, just thank you for having me, and I'm hoping that your viewers learned something, and that this is just the start of a broader conversation that we as people, as a country, need to be having about mental health, and the importance of being aware and normalizing that it's okay to speak up and it's okay to seek help.
I think normalizing is it's the correct word. Like if a person has a headache, it's normal for them to get a pill. If a person has something in their tummy, it's normal for them to go to the clinic or to a doctor. But if a person is not feeling mentally okay or emotionally okay, it's not normal for them to get help. And we definitely need to change that and normalize getting help, even for our mental health, as that affects the rest of our health. Thank you so much for coming through and for all your time, all your information.
Thank you for having me.
I believe a lot of people have learned a lot of things, as I have as well. That was Dr. Khomotso. I will leave her handle and all her details down in the description below. Thank you so much for being with us these 3 weeks of Mental Health Awareness Month. Next week we'll be having our final episode of the series. Be sure that you're subscribed. You have clicked the notification bell so that you are informed the minute we upload the video. I really hope that you guys are learning as I am learning. Be sure to leave some comments. What are you learning? What questions are being raised within you? What are you going to do better or different from everything that you are learning from this series? With that said, I'm Katla Omari. This is Dr. Khomotso, and bye for now. We done!